My name is Carina Storrs. I'm a freelance science writer based in New York City. I recently traveled to Bangladesh and to India on a travel grant from the Pulitzer Center on Crisis Reporting. I set out to explore the problem that certain vaccines that prevent some pretty nasty infections, and in some cases even prevent death, these vaccines don't work as well in low income countries as they do in high income industrialized countries. One of those infections is with rotavirus. This virus spreads through contaminated food and water. It can even spread from person to person. The infection causes diarrhea, and in young children, this diarrhea can be so severe that it leads to dehydration and, in some cases, even death. In Bangladesh, rotavirus infections kill nearly 6,000 children under the age of 5 every year. Studies of the rotavirus vaccine have found that in Bangladesh, it only prevents about 43% of cases of severe diarrhea in young children. Those rates are about the same in places like India, countries in Africa and South America. But if you look in countries such as the United States and Finland and developed countries, the rotavirus vaccine prevents about 98% of cases of severe diarrhea in young children. If you talk about this discrepancy with doctors in Bangladesh and India, as well as infectious disease experts in the United States, they're pretty matter of fact about it. They've known about this problem for decades. They still think that vaccines that don't work as well in low-income countries are still hugely important in these areas. They don't want that point to be missed, but they're very familiar with the fact that these vaccines could work much better in areas that need them the most. For me, as an American journalist covering mostly medical stories in the United States and Europe, this was news to me. We hear about challenges with vaccines in low-income countries, such as making sure that every single child gets vaccinated and also just delivering vaccines into rural, hard-to-access areas. But the idea that even under the best case scenario, these are clinical studies where doctors monitor children very closely and make sure that they all get the right dose of vaccine. Even under these circumstances, children in low-income countries tend not to develop the same level of protective immunity as children elsewhere. This was news to me. So I wanted to explore how many other vaccines, in addition to rotavirus, do not work as well in low-income countries, and how long has this problem been going on? Also, I wanted to find out what researchers think could be causing this problem, and most importantly, what are researchers doing to try to improve the performance of these vaccines in low-income countries? I chose to travel to Bangladesh and India in particular for several reasons. In India, all the way in the south, in the state of Chennai, there is a hospital there that did some pretty groundbreaking work in the 1960s on oral polio vaccine. They found that there are several babies that even after getting oral polio vaccine developed polio paralysis. These were the first hints that certain vaccines would not work as well in low-income countries, and I got to speak to the doctor that was at the forefront of that research in the 1960s. In Bangladesh, there is one of the largest research institutes studying diarrheal diseases, including rotavirus, but also cholera and other bacterial and viral infections. This research institute in Bangladesh is taking an approach in general that was pretty revolutionary when they started out in the 1960s, and it's still going on today. So they've collected a lot of data, and what they do is they go into communities around Bangladesh and they track diseases so they can learn more about them, about the risk factors for those diseases, and also test possible interventions. This institute is studying the underperformance of rotavirus vaccine in particular and ways to potentially improve it. And one of the reasons they're able to do this in Bangladesh as well as other Asian countries is because unlike countries in Africa and South America, they have not introduced the rotavirus vaccine into the routine immunizations that all children receive. So researchers are able to vaccinate a subset of babies, young children, and then compare them and the diseases they develop with the larger population of babies who will not receive the vaccine. I got to talk with some of the families participating in the rotavirus vaccine study in Dhaka, the capital of Bangladesh. I was struck by how generous the mothers were with their time. Some of them even made special trips to the clinic during the day to be able to speak with me. And for the most part, the mothers seemed very grateful. They said they were very grateful for being in the study, for having the opportunity to get the rotavirus vaccine for their babies, which they may otherwise not have been able to afford. And they were also grateful for the basic health care that their whole family got during the study period as an incentive to be in the study. And even the mothers whose babies still developed rotavirus diarrhea were still grateful for the study. They were not angry with the researchers. They were surprised or confused. One mother looked straight at me and asked me that question: why, if my daughter received the rotavirus vaccine, did she still develop rotavirus diarrhea? And I told her I didn't know that was the question that researchers were trying to answer. Now I'm writing stories about what I learned on my reporting trip. I'm writing a story for Health Affairs, which is a health policy journal. That story will focus largely on the lessons that researchers learned from the poor performance of the oral polio vaccine and how those lessons might be able to inform the efforts to improve rotavirus vaccine performance. Also writing a story for CNN Health, and that story will focus on how tackling the problem of certain vaccines in low-income countries might be solved in similar ways as other global public health problems, and that is by combining a number of different interventions. And one of those interventions could be improvements in sanitation, some of which are happening naturally in countries such as Bangladesh and India as they get richer. And other interventions might include medical treatments, and researchers are testing some of those now. So I hope you will take a look at the stories that come out of this trip.